From Chiromoni, we head to Mulanje Hospital. This is a mission hospital. The journey takes there to appreciate what GOAL Malawi is doing in reducing the burdens that the hospital encounters due to COVID-19 pandemic. This hospital serves people from different areas within and outside Blantyre district. In the absence of the Blantyre district hospital, Mulanje acts as such. No wonder Save the Children through GOAL Malawi decides to assist it. The project has donated a good number of buckets that the hospital is using for hand washing, oxygen cylinders, soap and trainings, just to mention a few. What is the situation like after this donation?
We have experienced that currently, now should we say 2 to 3 weeks now, indeed cases have decreased. Previously, we are having a lot of COVID suspects. They are being tracked at the screening point, and also being a testing center where from there at the screening point many were referred to be tested. But now we find that cases have decreased because even a week is passing without testing anybody, because almost all those people who are passing through the screening, they are not presenting with the symptoms to age clinicians or medical personnel to send them for testing. So that is a good sign to say indeed cases have decreased. We used to have even sometimes as a sign to say that indeed there was a big challenge. We could have a lot of brought-in deaths. Those dead bodies which were brought, maybe when they were coming, they thought maybe this client or patient was just unconscious, but after examination at the screening area, they were being declared that no, this one is a brought-in death. So we are receiving a lot during the night. But now, as I have said, in these 2 to 3 weeks, this has reduced.
What was the situation like before this donation?
Before ECHO came in, we only had constructed washing basins near the screening tent, one at the gate, one at the entrance near the reception, the main entrance, and we had one on the corridor from the reception going to the wards. There is one, and also one at the OPD. But now I'm saying at each and every corridor or entrance to an office, whether a doctor's office, whether a laboratory, offices where clients access treatment. Before we had a few, but now we have almost each and every place has a washing facility.
In such institutions, challenges are there.
Despite the assistance which we have received from GOAL, from ECHO through GOAL, we still have a challenge that we are in need of a tent, can be 1 or 2 tents, big ones, whereby we can set them as isolation ward so that we take care of those COVID-19 patients instead of referring them to Queens. Because our technical staff have been well trained, now they are saying, why should we refer them? We can even manage these patients here. So if we have tents, if we receive that support, also even air personnel, meaning human resource, that would help us, and Mulanje would have an isolation ward.
Another good thing is that it is also a training center for the community. They put into practice in their homes whatever they have seen at the hospital as preventive measures of COVID-19. The area is safe. These trainings are also helping Lunzu Training Center, which is very close to this hospital. Preventive measures of COVID-19 is a must to enhance prevention of the virus spreading around this area. The place has a lot to be desired, but it is a story for tomorrow. We are on our way to Chigumukire in Traditional Authority Kapeni, also to appreciate what the rural masses are doing to reduce the spread of the coronavirus that causes COVID-19. Chigumukire Teachers Development Center is our meeting point with the Area Civil Protection Committee. The committee is a beneficiary of ECO project.
The community didn't know about the COVID, how it is transferred, how they can prevent themselves, and the signs and symptoms they didn't even know. But through this community-led action, they have known how to protect themselves against COVID pandemic. And GOAL Malawi again assisted us in bringing the resources like hand washing soap, megaphones to society if somebody is sick. They brought us whistles, reflectors, masks in order to protect the community.
GOAL Malawi is also working with the community of Machinjiri. This is our final area to visit in the district before heading to Mulanje. Machinjiri Township is one of the largest area in Blantyre district. Lying on the southeast of Blantyre, it has both high and low class people, and it is overcrowded. The area has experienced high numbers of COVID-19 cases in the district. In order to reduce more infections, GOAL Malawi, through ECO project, assisted the area with assorted items such as whistles, masks, sanitizers, trainings, among others. How effective have these things brought to the community? Is there any change?
Community simaziwa china chilichonse imangomva mwina paledi patali koma chifukwa chakubwera kwa project imeneyi yatithandizira anthu kudziwa kapewedwe ka COVID-19, kudziwa kunena kuti pamalo amene tili pano ndi pasika pa anthu ambiri tikuyenera tipewe kuvala maski komanso kukhala motalikirana. Komanso zathandizira kuti olo tikapita ku misonkhano kukapangisa pamodzi timatha kupeza kuti pali bigiri komanso pali sopo chifukwa cha GOAL Malawi. Mauthenga amene akhala kuti patsa kwambiri phunziro limene amati community lead action. Anthu amatha kudziwa kuti pali ziwalo izi zimene zingathe kutenga ka COVID-19 zopumira komanso kutenga mwina kudzera kupasana moni zimene zonse community kutani ikudziwa ndeta kundula kwambiri.
Area of Senior Chief Chikumbu is one of the areas in Mulanje district to register COVID-19 cases, and it is a hotspot area. Ntenjira village registered 5 cases. This is the village we are going to visit today. Ntenjira village is 3 to 4 kilometers away from Chisutu Training Center, and we're covering that distance. GOAL Malawi is our guide to the areas under study. This village is in the area of Senior Chief Chikumbu that GOAL Malawi through ECO project spend their energy working with the community on issues to do with COVID-19 after being identified as a hotspot area. Just like areas in Mwanza and Blantyre, the village receives the same. Mr. Gray Likaka is a farmer and a carpenter and a community victim support unit chairperson. Wow, what a man he is. Being a chairperson of Civil Victim Support Unit, Mr. Likaka has a role to play in COVID-19 response. The village has inadequate resources to support the core. It results in work overload, stress and panic among members of the community.
zida zimene timaona kuti ifezo kuti sauti timwina tigire ntchito bwinobwino kwambiri kwake kunali kuona kuti zida zimene mwina tingathe kugwisa ntchito pomagwira ntchito ngati mwina kupulumutsa anthu pamene mwina akhuzidwa ndi matenda amene a COVID-19 nde anatipasa zipangizo zimene tikugwisa ntchito komanso upangiro umene tikunena kuti timakhala omasuka kupita kukakambirana ndi anthu nkhani zokhudzana ndi COVID-19 ndipo anthu amatani amatimvesa kuphunzirapo za matenda a COVID-19 tiona kuti ifeyo kwambiri timangomvera maradio zikumakambidwa nkhani ya COVID-19 koma bungwe la PROG Malawi litabwera kunoko linatikhazika pansi kuti tiphunzitsa bwinobwino mmene COVID-19 inayambira muziko mwathu munomo komanso limatha kutipasa data yona kuti tizitha kumaziona kuti anthu amene akhuzidwa ndi vuto limene ndi ndani ifeyo timapanga kalondolondo kuwapeza anthu ajawo ifeyo kuti tinali omasuka kumapangira misonkhano ndi anthu ajaso mwina timatha kuwaziwa pakutifikira mwa iyoka.
Chikumbu area is no exception for changes like the other areas covered.
Kusintha kumene kulipo ndikunena kuti aeko atabwera kuno kwathu kuzatizindikirisa za matenda amene wawo anapereka mphamvu ngati ku komiti imene timapita umakapangisa misonkhano malera onse asine chief Chikumbu kuwazindikirisa anthu za kuopsa kwa COVID-19 komanso kuti akaona zizindikiro zonse zaona kuti akuzida kwakunda kuti mwina ndi matenda kuti mwina chiyambire sanambe afikirako komanso timaonesera zizindikiro zimene iwo angathe kuzindikira kuti utendawo mwina wafikira ndi akaona zizindikiro zimene timanena kuti azithamangira kuti kuchipatala ndipo zipatheka kuna kuti anthu apatani amapita di kupatani kukaunikiridwa za vuto limene.
Considering that the fight against COVID-19 will be meaningless if the chiefs are left out, PROG Malawi provides them with a series of trainings on prevention measures and the importance of seeking medical attention in time once one develops signs and symptoms of the disease.
Kuno kwa senior chief Chikumbu magrupu tonse komanso mavillage headman ndi mafumu ang'ono ku nkhani ya COVID-19 tinakhala pansi kukambirana mafumu maka kuzera project ija ya PROG Malawi imene ikuthandizidwa ndi aeko. Titakhala pansi mafumu tonse maka magrupu tinaphunzitsidwa ndi PROG Malawi mmene tingapewere matenda wa COVID-19 komanso mmene tingaziwire kuti munthu ngati akudwala COVID-19 zizindikiro zake zimaoneka bwanji. Ndi atatiphunzitsa PROG Malawi mafumu tinapita ku midzi ndi kukaphunzitsanso makomiti osiyanasiyana ngakhalenso kukaphunzitsa anthu athu ku midzi mmene tingapewere ndi mmene tingaonere zizindikiro za COVID-19.
To enhance these measures, chiefs in the area have developed plans and guidelines.
Mabulani ndimakamaka ife mafumu komanso ndi makomiti osiyanasiyana amene tinakhazikitsa tinapanga ngati mabylaws amene tinakamba zoti tikakhala ndi mikumano yosiyanasiyana imene tingakhale nawo kumudzi kwathu aliyense wakumudzi akapezeke kuti azivala maski. Makamakaso tinalimbikitsa kwambiri chifukwa chakuti magulu ngati maliro kwambiri ndi mmene mumapezeka anthu ochuluka. Tinalimbikitsa ife mafumu kuti maliro akaoneka m'madera mwathu tiyesese ndithu kuti wina aliyense amene apezeka kubwera ku maliro avale maski. Ngati savala maski ndithu munthu ameneyo abwezedwe ku maliro. Motero ngati mfumu ufike pa maliro cham'ma 10 o'clock umaonesesa ndithu kuti ulengezese kuti wina aliyense amene akuoneka kuti wapanga wayiwala maski ku nyumba bwererani mukavale maskiyo muzibwera. Cholinga chathu chonsechi ndi chakuti tipewe corona virus. Ndondomeko zitu tikuziona kuti zathandiza kwambiri chifukwa mwachizikire kunoko kwa senior chief Chikumbu amene anapezeka nawo corona virus amene tinamvera ndikalekale koma panopa tikamamva ndithu mawayilesi ngakhale tikamafufuza panopa sitikupeza kesi kuti munthu wapezeka nawo kuno kwa senior chief Chikumbu. Ndiye chimene chikutionesa kuti ndondomeko imene tinayikonza ndi pulani imene tinayikonza kuno kwa senior chief Chikumbu zikuyenda chifukwa choti makesi amene amapezeka m'mbuyomu ndi pano ayi kulibe kunoko kesi ina iliyonse kwa senior chief Chikumba.
Located on southern end of Lake Malawi lies a unique 6,273 square kilometers Fort Johnson, the district today known as Mangochi. Its uniqueness lies within the diversity in its range from floodplains to woodlands, the beautiful water, setting and teeming chambo, and the blue fish that it offers to thrilling tourists. Others simply call it the natural paradise. As we end this edition, we travel to Traditional Authority Jelasi to meet Aerial Civil Protection Committee and Malombe Health Center in Traditional Authority Chowe to appreciate the COVID-19 response initiative that served the children Malawi through Trociare and Catholic Development Commission has taken under ECHO project. The community of Jelasi is one of the beneficiaries of ECHO project. The area, lying along Shire River and being in typical rural area, is prone to the pandemic. It has a large population. Messages on COVID-19 were hardly heard. Today, the community is safe. The coming in of ECHO project with different interventions through the provision of PPEs and trainings, the community is observing social distance and wearing masks and washing hands frequently, unlike before.
The project has benefited us a lot, mainly in the community, in terms of behavior change. Most of the individuals are able now to put on masks and also are able to observe social distance, which we hope that the spread of this coronavirus is likely to get reduced.
Though things look positive in this area, children are left out. The school has no hand-washing facilities and children are not wearing masks. This puts them at risk.
What we have done possibly is to make sure that we enhance sensitization meetings at the VCPC level and also on SCPC level, and just to make the households, maybe the parents, aware of the preventive measures, so they are able also to incorporate the children in terms of hand washing and also the masking and also social distancing. So as I've seen, even at the household level, people that as households, they're able to follow these preventive measures in terms of hand washing, social distancing, and also even other households, well-to-do households, they're able to buy sanitizers so that even the children can be using these materials for them to get protected to this COVID-19.
It is time to leave for Malombe Health Center. From Mbalula Trading Center to Malombe Health Center, we cover a distance of 27 kilometers, and it is one of the most hard-to-reach area in the district. Located 1 kilometer to the east of Lake Malombe, lying in a wet dumbleland, it serves 25,000 people, including those from Mozambique. Being far from the district hospital, the health center has been facing a number of challenges, including compliance to COVID-19 preventive measures. In order to mitigate the situation, Save the Children Malawi, through Trociare and Catholic Development Commission in the district, they provided trainings to frontline staff on how to manage COVID-19 cases. This is a blessing to them. Being a public and treatment place, it is a must for the facility to have adequate water. This was not the case here. According to the information given by the in charge of the health center, the pump was stolen. Considering that water is key in the fight against COVID-19, Save the Children Malawi, through Eco Project, repairs the pump. According to the in charge, all suspects of COVID-19 are referred to Mangochi District Hospital, which is 39 kilometers away. This frustrates many. As a result, many die without knowing the cause. In cases where one has accepted to go for a test at the district hospital and unfortunately dies on the way, the bereaved family members spend days in transit when the road is impassable due to heavy rains.
It was our wish that Malombe, as I had to reach earlier, we should be testing rapid test here. You know, rapid test results comes out even in less than 15 minutes. So it was a wish, issues to do with rivers and the likes in rainy season like this. It's hard for transportation from district office and to health centers like here as we are in Malombe. So it was a wish, like DHO should intervene, and the donor who is assisting us in fighting against COVID to work together with the district office, that they should help us, that as a facility, we should be one of the testing site and help the patients right away, those who are having moderate or mild conditions.
How has the community benefited from this project?
Ndikuva kuti tapindula chifukwa choti tikati tapindula ndekuti anthu akuchimvesa chimene timakhati kumakambirana nawo kwa ife tikuona kuti tapindula ndithu.
Though the community has benefited from the project, still there are challenges.
Mavuto pakali pano kuzoona kuti chabwino muliri umene tinali nawo kapena pa zinthu zimene talandira pano kuti tithokoze mwachamunanene yapoyamba kuti kupindula kwathu kupitabe koma mavuto tikhoza kuti alipobe chifukwa choti kuchimvesa kwa munthu wa ku community chetu kumakhala kovuta. Ndiye ndikhoza kuti matraining tinachita komabe kuphunzitsa kwa anthu panene adi nditumapitirira kuti vuto limenelo mwina lioneke kuti likutsirizika chifukwa choti chilonda chimaoneka ngati pa mtunda pachapola pamene mkati bala lidakalipo kuti zimenezo mavuto osamene tiona kuti zikanapitirira ndithu kapena thandizo kumatithandizabe ngati mezo kukhalira panopo.
Schools in these areas have benefited from the initiative. Malombe Primary School is one of the beneficiaries.
Our school indeed is one of the beneficiaries of this project. This donation has helped us because it has increased the test of the equipment which we are using to combat this COVID-19 pandemic. Our school has high enrollment. Therefore, previously we had less resources, less buckets and pails. So the coming of this donation has increased the resources. We have received 8 buckets and 5 cartons of fresh soap. So it has indeed helps us.
It is time to get back. Life in Malombe, in the area of traditional authority Trociare, is as seen. Despite all these hassles, the area is beautiful. The green wipes the tears. Rice harvest and fishing is a living. Happy they are with the status quo. This is Mtua Market. People come and buy their things at this market and is normally busy on market days. Our final destination is the district hospital. Just like Mwanza, Mangochi has also received various donations under ECHO project. Among them, staff members, especially those dealing with the non-communicable diseases, were provided with trainings. What is the link between non-communicable diseases and COVID-19?
Non-communicable disease and COVID-19, they are linked. Patients that are having conditions like hypertension, diabetes, when they are suffering from COVID-19, they fall very sick, and then these are the cases that are dying. For instance, here we have had the cases which were admitted in our isolation center. We only have 5 patients who died, and among the 5 patients who died, 3 had hypertension, 1 had diabetes, and the other one had, of course, we were not sure of the diagnosis, but it was quite a TB. Yeah, so that's the link. So now, with the coming in of the Agatha Health Commission, we found maybe support from Save the Children and the like. They have helped us in the training sessions which we had. We trained the nurses and the clinicians in 6 designated health facilities, including the DHO, and we have so far trained about 84 health workers, nurses and clinicians as well. So that has helped, the training has helped as well in terms of how we manage the patients of COVID-19, how we diagnose them, and including all the care that we offer the patients. So that is very important. And again, since nurses and the clinicians have known on the best ways of managing the patients of COVID-19, as well as those that are having NCD conditions like asthma, maybe, for instance, that has improved the recovery rate. Recovery rate initially was about 90, it was 86.7%, and then now, as of 3 days ago, it's 96.7%. So that has improved. And the death rate dropped from 1.7% to 1.4% now. So that is going to attribute to the type of care the patients are receiving in our solution center.
This is what and how Save the Children Malawi is doing in response to a call by the Malawi government made in the fight against COVID-19. Should we say Save the Children is satisfied?
Yes, I'm satisfied because looking at the objective of the project, I think, as I say, that the project is aiming at reducing the spread of this pandemic, as well as maybe rapidly respond to cases of COVID-19. Looking at whatever we have been doing, you see that in terms of rapid response, we have managed to rapidly respond to COVID-19 through the equipment that we have been doing, the capacity building that we have been doing, especially on the health workers. Those trained health workers have managed to respond to these cases, and even the medical equipment that we managed to procure, they have been used to help the patients, more especially those with COVID-19. And in terms of reducing the spread of the virus, the PPEs that we have been procuring and distribute to health workers, they have managed to reduce the spread among the health workers and even the communities, and even the wash supplies that we have procured and distributed in markets, in schools, and even the hospitals. They have managed to reduce the spread of this pandemic. And you agree that maybe the districts that we are talking in, some of them are the border districts, but they were not really hardly hit by the pandemic, maybe because of the coming in of the project. So even the reduction of the cases as of now, we might be attributing to the interventions that the project is implementing in all those districts.
So much to learn, so much to see, so much to breathe in, so much to leave behind. Let us continue washing hands, observing social distance, wearing masks, and make sure you get your jab as we fight COVID-19.
We've been fighting COVID-19 for a year now, and we are winning this war because you have taken seriously your part in making sure the virus does not spread. Despite the fact that the vaccines have arrived, I want you to still make sure that you follow all of the preventive measures that are already in place.
We are on track and we will win.